So very good evening all of you. Hi Richa, hi Ganga, Bernice, Akshaya, BA, Anushita, hi Monica. Glad that you're joining us today. Hi Subhasesh, hi Anaka, a very good evening. Hi Manush, hi Harjit, hi Sarjana, hi Purvel, a very good evening. Good morning for you. Bernice, seems it's very cold there. Yes, to some extent. Hi Shubhi. Okay, BA. Hi Pragati, a very good evening. Hi Manash. Hi, a very good evening all of you. Right? I hope you have gone through the soft copy of questions from Pharmacology in Google Group. So we shall proceed with the same, right? So the first one. All of the following are functions of receptors except. All of the following are functions of receptors except. Option A, to propagate regulatory signals from outside to within the effector cell when the molecular species carrying the signal cannot itself penetrate the cell membrane. Option B, to diminish the signal. Option C, to integrate various extracellular and intracellular regulatory signals. Option D, to adapt to short-term and long-term changes in the regulatory milieu and maintain homeostasis. So, all of the following are functions of receptors except. Hi Jakario, you're from Iraq? Okay, glad to hear from you Jakario, and welcome to our live session. Yes, so we have a division of opinion between option B and option D. BA says all are correct. So what are the functions of receptors? Hi Deepak. Hi Gargi. Hello. Yes Jakaria, I do love you. Right, so the functions of receptors include all of the following except. See, obviously the receptors, because of stimulation or because of action of some chemical messengers, there is amplification of signal. As such, in few circumstances, the chemical messenger might not be able to enter into the cell and bring about the required change which is necessary for homeostasis. So, the function of these receptors is to amplify signal which is brought about by a chemical messenger, right? So, option B is false. It's an exception. So, the functions of receptors include to propagate regulatory signals from outside to within the effector cell when the molecular species carrying the signal by itself cannot penetrate the cell membrane, which is absolutely right. And to integrate various extracellular and intracellular regulatory signals, and most importantly to maintain homeostasis, right? And also to amplify the signal. So all these are the functions of receptors. Make a note, right? Okay, now let's move on to the second question. Drugs can affect the fetus at which of the following stages? Drugs can affect the fetus at which of the following stages? Option A, fertilization and implantation. Option B, organogenesis. Option C, growth and development. Option D, all. So, drugs can affect the fetus at which of the following stages? Fertilization, implantation, organogenesis, growth, development, and for last option, all of the above. teratogenicity is very, very important. Yes. So we have almost all options here. Few of you say B, few of you say C. Okay. So first of all, let me ask you somewhat related questions pertaining to the same. What is the duration, or from which time to which interval, or what is the interval for fertilization and implantation? And also, what is the interval for organogenesis, and what is the interval for growth and development? Hi Shivani, a very good evening. So what I'm trying to ask you is, give me the timeline for various events like fertilization and implantation, organogenesis, growth and development. So from which time to which time you call these periods in specific? Hi Soumya. Very good, Ganga. Yes. Conception to 16 days. In fact, conception to 17 days as per your textbook is a period of fertilization and implantation. Very good. As Ganga rightly mentioned, conception to 17 days. It is a period of fertilization and implantation. Yes. And organogenesis is from 18 days. Since conception and fertilization and fertilization and implantation is still 17 days. From 18th day to 55 days is a period of organogenesis. 18 to 55 days. Do make a note of this, right? And finally, growth and development from 56 days onwards. So conception to 17 days, 18 to 55 days, and from 56 days onwards, right? So fertilization, implantation, organogenesis, and growth and development. Drugs can affect fetus in all the three stages. It can be fertilization, it can be organogenesis, or growth and development. All the three stages. Option D is right answer. In fact, fertilization and implantation is a period where failure of pregnancy often goes unnoticed. And the period of organogenesis is the most vulnerable period to these teratogenic effects of various drugs. Very, very important. And also, there are certain drugs which affect the growth and development of fetus. For example, ACE inhibitors, angiotensin converting enzyme inhibitors. These can cause hypoplasia of various organs, especially lungs and kidneys. Do make a note of this. ACE inhibitors can cause hypoplasia of lungs as well as kidneys. And NSAIDs can cause premature closure of patent ductus arteriosus, right? So these are some of the examples where drugs can affect the fetus in developmental stage as well. So drugs can affect the fetus at which of the following stage? It's all of the above. Option D is right answer. Yes, Ganga. Now let's move on to third question. It's related to a classification, again purely memory based. H1 antihistaminics which have least sedation include diphenhydramine, promethazine, phenyramine, chlorpheniramine. Of the following drugs, which have the least sedation potential? H1 antihistaminics which have least sedation potential include diphenhydramine, promethazine, phenyramine, chlorpheniramine. So the classification is very important. We have first generation and second generation drugs. First generation we have highly sedative, intermediate and low sedative potential drugs, and also we have second generation drugs. So go through the classification, it's very, very important. So this question is framed based on the classification. Yes, Jakaria, if you have any questions, you can drop them at proudtobedentist@gmail.com, right? Yeah. Yes, it is chlorpheniramine. It's mildly sedative. Very good. So highly sedative drugs include diphenhydramine, dimenhydrinate, promethazine, hydroxyzine. Right? You can just go through the classification. And phenyramine comes under moderately sedative antihistamine. Right? And option D, chlorpheniramine, is very mild sedative. Good. Option D is right answer. So make sure that you're noting down all the classifications in a separate book and try to get used to them. In fact, you need to memorize them as many times as possible because it's highly volatile. The drug names and all, no matter how much effort we put in, we often tend to forget, right? So we need to repeatedly revise them time and again so that you can master and you can have grip over all the names by the time the exam approaches, right? Now, moving on to the penultimate question. Features of acute alcoholic intoxication include all except hypertension, gastritis, hypoglycemia, coma, and death. Features of acute alcoholic intoxication include all except hypertension, gastritis, hypoglycemia, coma, and death. Acute alcohol intoxication. Features clinically. Yes, impressive. So most of you say option A. Yes, Komal, Lakshya, Ganga, Khala, B.A., Deepak Singh, Subhasish, Thar, Sepian. Hi. So what are the side effects of moderate drinking? We'll start with that. What are the side effects of moderate drinking? Yes, Jakaria, you're right. Option A is right answer. Yes, Srividya. Yes. The side effect of moderate drinking. Euphoria. Yes, also raised BP. Hypertension at low doses. Make a note of it, very, very important. At low alcohol doses, there is hypertension, but at higher doses, there is hypotension. I'll discuss why. And along with that, as Akshay rightly mentioned, okay, euphoria, fatty liver, liver dysfunction. Okay, these are all long term, right? Okay, weight gain. Right. The side effects of moderate drinking include nausea, vomiting, flushing, hangover, and of course, traffic accidents, isn't it? And acute alcohol intoxication, the symptoms include all the given options: gastritis, as well as respiratory depression, coma, death, hypoglycemia, and also hypotension, but not hypertension. So the symptoms of acute alcohol intoxication include hypotension. And there is hypoglycemia because severe amounts or higher doses of alcohol would spike the levels of insulin as per few articles, as a result of which there can be hypoglycemia, right? So the symptoms of acute alcohol intoxication include hypotension, gastritis, hypoglycemia, coma, and death, right? Alcohol affects many body functions in dose-dependent manner. Very, very important. Vasodilation, flushing, tachycardia, mild rise in BP, but at higher doses, there can be drop in blood pressure. So they primarily cause vasodilation, flushing, tachycardia, as few of you rightly mentioned. Yes, hangover. Right, so as you all rightly mentioned, option A is right answer. Okay, good. So make sure that you read the entire question for that reason. We can have the term or word except at the end, right? So make sure that you're not landing in so. Final question. Again, another question on drug interaction. Let's see how many of you will answer. A young female patient on oral contraceptives took tetracycline. So previously we had the same question, but the patient took penicillin, but now the patient has taken tetracycline. So what could be the possible outcome? A young female patient on oral contraceptives took tetracycline. What could be the possible outcome? Decreased efficacy of tetracycline, effective contraception, increased efficacy of tetracycline, none of the above. Yes, we already uploaded this in Google Group last Monday itself. You can check out Google Group. Yes, Shakaria, drop a mail. You'll definitely have my guidance, right? Okay, good. Yes, Shubhi. Shubhi says option B. Thar, Setyang, option D, Akshaya, Deepak, Bernice, Komal, BA, Soumya, Ganga, right? Yes, the mechanism is the same as discussed previously, the penicillin or tetracycline. They are known to inhibit or affect the intrahepatic circulation of estrogen. In fact, contraceptives, they contain a hormone which is artificially induced in order to prevent ovulation and also to bring about some morphologic changes within the cervix, right? So because of which there will be contraception. So on giving antibiotics, these can interfere with the intrahepatic circulation of these contraceptives, right? And then there can be, obviously, as you rightly mentioned, option D, none. So there is failure of contraception. Conception, contraception, right? So they suppress ovulation and thicken the cervical mucus. Fine. So these are some of the topics which I wanted to highlight in this particular live session. I hope it's clear. Hi Devna, we're just about to conclude this session. Anyways, we'll just have a brief summary. So in the first question, we have seen various functions of receptors, right? And how they carry the signals and amplify the signals and what role they have in maintaining homeostasis. And later we have seen like various stages of fetal development and drugs acting at different stages. In fact, drugs act on all stages, and also we discussed few examples. And later we have gone through the classification of H1 antihistamines. We have discussed about drugs based on their sedative potential. Chlorpheniramine of the given options is mildly sedative, whereas option A and B, diphenhydramine and promethazine, they're highly sedative, whereas pheniramine is moderately sedative. In fact, we had several questions on the same pattern previously also. And features of acute alcohol intoxication, we have discussed in detail, and also about drug interactions, right? So make sure you go through all the drug interactions which are given at the end of your textbook. We have a use table wherein various drugs are mentioned, and also the mechanism has been given in detail, like how exactly the interaction is happening, right? I hope it's clear, and if you have any further questions, you can always drop a mail at proudtobedentist@gmail.com, right? Yes, it is D. There is failure of contraception, right? So we'll see you again next week with more topics, and we'll leave a soft copy of MCQs in our Google group. As discussed, we are creating these multiple choice questions, right? So you will not find them anywhere. So make sure that you go through the soft copy and solve the questions and attend the live session after solving them, so that you can follow the live session even more effectively, right? And also starting new batches for AIMS and PGI, July 2018 session. Interested aspirants can drop a mail for details regarding mock tests and also e-classes, right? Yes, Shubi seems to have some point. No, Shubi. There is failure of contraception. Patient might become pregnant. It's not effective contraception. Contraceptives will not work because their circulation is being inhibited. I hope you got my point. There is failure of contraception because there is interruption of intrahepatic circulation of progestin or whatever compound is there in that contraceptive. Yes, and also we're planning mock tests in AIMS and PGA format. We have even created a test series schedule and have discussed the same in yesterday's video. And you need any further information, you can always drop a mail, right? And most of you are asking like how to download the soft copy. All you have to do is drop a mail at proudtobedentist@gmail.com. We'll send you a link of Google group. You can join the Google group wherein we'll be sharing all the updates from our academy, including the soft copy of MCQs, which we'll be discussing for live sessions, right? I hope it's clear. So drop a mail, we'll guide you accordingly. Yes. So see you again next week with more and more topics, and I hope your preparation is going on fine. There is nothing to get demotivated. You have ample amount of time. Those who are preparing for NEET MDS 2019. So believe in yourself, give your best, and obviously the best comes to you. Love you all. Take care. Bye. Yes, Devna. You shouldn't be asking me this question. You joined 5 minutes before concluding the session and you want me to extend the session, it's not fair. If you are right from the beginning, then you'll feel like these sessions are obviously longer. See, research shows that it's nearly impossible to focus on any lecture which is more than 20 to 30 minutes stretch. That's the reason why we try to put our recorded videos in less than 10-15 minutes frame time. Even live sessions previously, last year and all, we were doing live sessions for 1.5 to 2 hours and even 2.5 hours. But it's highly exhausting and I don't know how much goes in. So if you put the live sessions or any lecture for a short duration, it's going to be more and more sweet, right? Yes, Satan, any questions you can drop a mail, right? Yes, Devana, I'm just kidding, don't worry. Okay, good night, take care, love you.